in psychological disorders, on occasions, we develop a lot of physical manifestations. And people actually present with these physical manifestations. So for example, a person who's in a state of stress, or a person who's in a state of high anxiety, or a person who's depressed, will present with the emotional and psychological symptoms of the disorder, but simultaneously may also present with physical manifestations. Now, when we look at the stomach or the gastrointestinal tract, then a lot of individuals present with symptoms such as increased acidity, gas, burning, a sensation of bloating. Many will actually present with, pain in the abdomen, a feeling of nausea as well as vomiting, along with diarrhea and constipation. Our gastroenterology department says that as many as 50 to 70% of people who present to the OPD with symptoms like these do not have a medical disorder, and these are all of psychological origin. A lot of people present with palpitations, the heart is beating faster, a sense of constriction in the chest, a sense of heaviness in the chest. On occasions, they may also report breathing difficulties. They feel breathless after, even a short walk. So many of these will go to the cardiologist. Some of these people will go to the respiratory team because of shortness of breath. They, at the face of it, appear like cardiac symptoms, but the necessary investigations, the ECG, the echoes is done and everything is found to be normal. And again, this is a set of people who may be having anxiety. A lot of people report to physicians, and they report to physicians because one of the most common symptoms is easy fatigue. So even a little amount of work precipitates a lot of fatigue. They will go through their set of investigations. On occasions, they may have vitamin deficiencies. The vitamin deficiencies are taken care of, but the fatigue still does not seem to go away. So fatigue is a common symptom. Easy fatigue is a common symptom of people who may be in a state of stress or who may be depressed. And then vague aches and pains, on occasions referred to as fibromyalgia. Vague aches and pains all over the body may be another manifestation of somebody who's in a state of stress. Now, one of the clues for us is that if these symptoms are of a psychological origin, then invariably they may be accompanied by or precipitated by, let's say, stress, a difficult life situation. They may be experiencing other symptoms such as problems in sleeping, problems in, don't feel like eating, so reduced appetite. They may generally be feeling very, very anxious. They may tell themselves, or they may feel that the mood is not great. They are feeling sad or depressed. They are feeling irritable, overthinking, wandering mind, and generally in a state of stress. The best thing to do is first visit the concerned physician, first visit the concerned gastroenterologist, because we do not want a medical diagnosis to be missed. What goes wrong, or where people go wrong, is that even after having, been explained that the investigations are normal and they need to go to a mental health professional, the understanding that these symptoms are of psychological or can be of psychological origin is not there. So we may end up going to another doctor, we may end up changing the hospital, we may end up going through the same set of investigations all over again, and that doesn't help. It just prolongs and prolongs and prolongs the process. And it's not uncommon for us to find people, such people are there in my OPD every day, and it's not uncommon for us to find people who've been doing this and they've virtually exhausted every, medical doctor, every hospital, and after years, and believe me, after years, the realization sinks in that they may be of psychological origin, and then they visit us.